General principle of management of poisoning. Poisoning is an emergency situation where immediate resuscitative measures have to be adopted, and also removal of poison from the body, both absorbed and unabsorbed, has to be done to save life of the patient. Immediate measures or in common coma in comatose patient should be adopted to stabilize. अब ये इमीडिएट मेजर्स क्या है, ये नीचे लिखे गए हैं चार, जिसमें फर्स्ट है एयरवे मेंटेनेंस इंडोट्रैकियल इंटरब्यूलेशन इज नीडेड. एयरवे मेंटेनेंस फर्स्ट स्टेप. इफ नीडेड ऑक्सीजन सप्लाई have to be done. Circulation should be maintained through IV fluids and drugs. CNS depression should be correlated by drugs and supportive measures. A removal of poison from the body. If poison is inhaled as gas, then patient should be removed from fresh air. Artificial respiration should be done. Oxygen therapy, that is 6 to 8 liter per minute, should be given. The air passage should be kept clean from mucus by postural drainage or by aspiration. For injected poisons, tight ligature should be applied immediately above the wound, which must be loosened for 1 minute after every 10 minutes to prevent the gangrene. Wound should be excised. Poison sucked out. Poison neutralizes with suitable chemical substances. Local vasoconstriction can be done with injection of adrenaline. Immersion of extremities in water at 10 degrees Celsius slows capillary blood flow and limits the absorption. Contact poison. In case of contact poisons, the contaminated clothes, jewelry, contact lenses of the patient should be removed immediately. If poison is applied to the skin or wound or inserted in vagina, rectum, urinary bladder, it should be removed by wash those areas with running water for 30 minutes and neutralize those patients with antidote chemical substances. Eyes should be irrigated with normal saline for at least 15 minutes. Ingested poisons, gastric lavage. It is indicated with 3 hours of ingestion. It is done as early as possible. For this purpose, stomach tube or Edward tube or Boa tube is utilized. Description of stomach tube. In this diagram, they shown the rubber tube. The whole apparatus is stomach wash tube, which have rubber tube, suction bulb, mouth PVC and funnel. Material: flexible red rubber tube, length 1.5 meter, diameter 1 centimeter maybe. Upper end funnel, lower end blunt round with 1 or 2 lateral openings. Midpoint suction bulb, mark at 50 centimeter from lower end. Procedure: this is the procedure as shown in the diagram. The patient should lay in the left lateral position. The tube is inserted up to the 50 centimeter mark on it. The head should be at the lower level supported by assistant. The mouth gag is used to prevent the biting of the tube. The wooden mouth gag with a hole in its center to allow the tube to pass through should be used. Introduce the tube very carefully to keep it away from the trachea. About 250 ml of warm water should be poured through the funnel. When the funnel is empty, lower it and the suction bulb is pressed to expel the contents from the stomach. The first wash should be preserved For chemical analysis, appropriate antidote can be added to the water used for stomach wash depending on the case. In children, trial tube is used to aspirine the contents. Contraindication: convulsions, corrosive poisoning, unconscious patient, volatile poisons, esophageal varices, hypothermia. These are the contraindications where we can't do this process. Point administration of emetics. It should be done in case of difficulty in using stomach tube. Vomiting can be produced only if medullary center is still responsive. Due to the danger of aspiration of gastric contents, vomiting should only be introduced when a conscious patient is lying on its side with the head dependent. Common emetic used is ipecacuanha powder and syrup can be used as a safe emetic. Household emetics such as mustard powder, common salt, etc. are not recommended. Administration of antidotes. Antidotes are the substances which contact or neutralize the effect of poisons. Mode of action of antidote: inert complex formation, for example, chelating agents for heavy metals, dicobaltadinate for cyanide. Second, accelerated detoxification, for example, thiosulfate for cyanide. Third, reduced toxic conversion, for example, ethanol for methanol. Fourth, receptor site blockage, for example, naloxone for opiates, atropine for organophosphates. Fifth, toxic effects bypass, 100% oxygen therapy in cyanide poisoning. Classification of antidotes. First, physical or mechanical antidotes. They neutralize poison by mechanical action to prevent their absorption. Activated charcoal. It is fine, black, odorless, tasteless and powder form. It can be used by mixing with water to form soap like slurry. Barbiturates, atropine, benzodiazepines, quinine and strychnine are well absorbed by activated charcoal. It is not useful in poisoning with corrosive heavy metals, cyanide, hydrocarbon and alcohol. Initial dose: 15 to 30 grams in children, 60 to 100 grams in adults. Demulcents. These substances form a protective coating on the gastric mucosa membrane and do not permit the poison to cause any damage. For example, milk, starch, egg white, mineral oil, and milk of magnesia. Bulky foods. These act as mechanical antidote to glass powder, thus prevent the damage by sharp glass particles. Chemical antidote. They counteract the action of poison by forming harmless or insoluble compounds or by oxidizing poison when brought into the contact with them. Example: common salt decompose silver nitrate by direct chemical action forms insoluble silver chloride. Albumin precipitate mercuric chloride. Dialysed iron neutralizes arsenic. Copper sulfate used to precipitate phosphorus. Potassium permanganate has oxidizing properties. 1:5000 solution of KMnO4 is used to neutralize the opium and its derivatives, strychnine, phosphorus, HCN acid, atropine, etc. The very famous universal antidote, which consists of activated charcoal, magnesium sulfate, and tannic acid, is not used nowadays because of it is found that tannic acid interferes with the absorption capacity of activated charcoal. Physiological and pharmacological antidotes. They act on the tissues of the body and produce symptoms exactly opposite to those caused by the poison. They are used after some of the poisons in absorbed into the circulations. They physiologically antagonize the effect of the poison in the body. For example, atropine used in the organophosphorus poisoning and diazepine in strychnine. Specific antidotes. These are the substances which inactive the poison by directly reacting with the poison in the blood tissues or by inhibiting the action of poison at the receptor site. For example, chelating agents in metallic poison, oximes in organophosphate poisoning. First, A point, that is chelating agents useful in heavy metal poisoning. Due to greater affinity towards heavy metal, they form complexes with heavy metals which are more water soluble than itself, resulting in higher renal exertion of the complex and inactivation of heavy metals. BAL, British anti-leucite dimercaptopurine, used as chelating agent in arsenic, lead, bismuth, copper, mercury, gold, thallium, and antimony. Dimercaprol has two unsaturated sulfhydryl groups which have high affinity towards heavy metals, which combine with heavy metal and thus prevent union of arsenic with SH group of respiratory enzyme system, which is rapidly affected with these heavy metals. Dose 3 to 4 mg per kg is given in severe poisoning in every 4 hours for the first 2 days and twice daily for the next 10 days as IM injections. Route IM, not IV, as it causes a chance of occurrence of fat embolism. Side effects. These are anorexia, nausea, vomiting, restlessness, salivation, lacrimation, body ache, rise in temperature, fall in BP, and burning pain in the eyes. B. EDTA, ethylene diamine tetraacetic acid. Uses. It is usually used in lead, mercury, cobalt, manganese, and cadmium poisoning. Dose 25 to 35 mg per kg of body weight. It is given twice a day for 5 days. Side effects. These include anorexia, nausea, vomiting, hypersensitivity, fall in BP, and vertigo. Penicillamine, cupramine. It is hydrolyzed product of penicillin. It has stable SH group. It is used as an antidote in copper, zinc, lead, mercury, etc. poisoning. Dose. It is given orally in the dose of 30 mg per kg and up to 2 gram per day for 7 days. Desferrioxamine. It is water soluble chelating agent having high affinity towards iron. It has trivalent iron as a chelate and very useful in iron poisoning. It is given 8 to 12 gram orally daily in divided doses to prevent the absorption from stomach. Forced alkaline diuresis. Forced alkaline diuresis is the administration of diuretic agents and isotonic saline with sodium bicarbonate intravenously, which increases the glomerular filtration rate and urine flows. This helps to achieve the urinary pH of 7.5 to 9 and promote the excretion of poison through urine. For example, salicylates, barbiturates poisoning, and aspirin poisoning. Peritoneal dialysis. Extracorporeal removal techniques such as hemodialysis, peritoneal dialysis, and hemoperfusion are commonly used in the removal of poison from the blood which has been already absorbed. Alcohol, long acting barbiturates, chloral hydrate, lithium salicylate, and bromide are examples of chemicals generally removed by the peritoneal dialysis. Hemodialysis. This is useful in poisoning with methanol, ethanol, ethylene glycol, chloral hydrate, and salicylates. This is not used in poisoning of organophosphates, kerosene oil, diligence, digitalis, copper sulfate, etc. Hemoperfusion. Toxins are removed by passage of anticoagulated blood through a device, usually a column that contains absorbent particles. This is used in poisoning of salicylates and paraquat. Nursing and psychiatric care. Mental status of patient has to be monitored. It is very important to maintain the normal electrolyte balance and to maintain the pulse, the blood pressure, and respiration. Coma cocktail. It is the combination of medicines which are given to the comatose patients in case of unknown poisoning. This combination includes dextrose 100 ml 50% solution, thiamine, vitamin B1 100 mg, naloxone 20 mg. These combinations should be given intravenously with the assumption that these persons are affected with alcohol, opium poisoning, or any other hypoglycemic drugs. Duties of medical practitioner in the case of suspected poisoning. Duties of medical practitioner are discussed below. Medical duties: care and treatment of the patient. Medical duties include emergency management of poisoning. Legal duties: assist the police to determine the manner of the death, collect the evidences regarding the poisoning. Medico legal duties: note the preliminary particulars of the patient including age, sex, address, date, time, and identification marks. In case of suspected homicidal poisoning, doctor must confirm his suspicion before expressing an opinion. Take history of the route of exposure. Quantity of poison is consumed. Time elapsed after poisoning. Collect vomiting, urine for analysis. Observe and record the symptoms. If private practitioner is convinced that a patient is suffering from homicidal poisoning, he or she is bound under the law S 39 of CRPC to inform the police or magistrate. CRPC 39 state that it is mandatory for individuals to report the commission of certain offences to the police or authority. Non-compliance is punishable under S section 176 of IPC. Any suspected article of food, excreta, and stomach wash samples should be preserved. Any recent stains on bedclothes and furniture should be preserved if possible. Non-compliance is punishable under section 201 of IPC. If doctor is sure that patient is suffering from suicidal poisoning, he is bound to inform the police. Section 309 of IPC, as per New Mental Health Act 2017, IPC 309 has been decriminalized, so attempting suicide is not considered as a criminal offense anymore. But doctors still have duty to inform the police if they believe a patient has attempted suicide or has been harmed by someone else. This is to ensure the patient's safety, provide appropriate medicinal care, and investigate any underlying risk or issue. If doctor is summoned by the investigating officer, he is bound to give all information regarding the case under section 175 of CRPC. If he conceals any information, or he or she is liable to prosecuted under section 202 of IPC, and if he gives false information, then he will be charged under the section 177 of IPC. A government MO is required to report the police all cases of suspected poisoning, whether accidental, suicidal, homicidal, attended in hospital. If condition of the patient is serious, he must arrange to record dying declaration. If the patient dies, he must not issue death certificate but should inform the police. In case of food poisoning, public health authorities must be notified.